Now let's continue on a conversation we started yesterday, looking at the health sector in Nigeria, the value chain, especially the local manufacturing in the healthcare value chain. And well, we have had the presidential initiative on for unlocking healthcare value chain, PVAC. That's been on since this administration started, and recently I did get like a lot of presentation on their achievements so far. And one of the achievements is supposed to be the area of localizing manufacturing. Well, yesterday we had good news from the MD CEO of Fitson. You know, he did say that we're doing 50-50 now, 50% local and 50% imported. We'll get more on that, as well as, you know, that a tax relief, tax waiver of 6 billion naira, which the federal government has offered to about 47 Nigerian manufacturers and all of that. But we'll drive that, as well as medical tourism. It's also one of the goals of that initiative, the presidential initiative, to reduce medical tourism. Are we on the path to reach that or not? We'll discuss all of this with the former chief physician to the vice president of Nigeria, Dr. Nicholas Odifren, joins us from our Abuja studio. Dr. Odifren, good morning and welcome to the program.
Thank you for having me, Edie.
Great. So I know that you have been following the activities of the initiative, the presidential initiative. How would you rate their achievements so far? We have what they have told us, but let's hear from your own perspective.
I think that they've done quite well, given the time frame that has been in place. As you know, there are a lot of challenges within the sector, but a lot of also optimism also going on in the sector. A lot of times, government has always had a problem seeing healthcare as a business. They see it from the perspective of public sector. One thing I do like about this present dispensation is that for the first time, they are looking at healthcare as a business. Hence, you have PVAC. You know, in any business, what are the issues that we require? We're looking for cheap financing. We're looking for reduced bottlenecks within regulatory bodies. We want regulatory bodies to see us as partners. We're looking for a market which is already there. We have Nigeria, 230 million people. So what we need is intentionality and focus, and PVAC has shown itself over the last 3 years to be that kind of organization. I mean, they've put together easy funding, they've brought together technical assistance, they've brought together cheap finance for businesses. So it's not the final solution, but we're seeing some progress made from our usual attitude in government. I have to give kudos to them, and I have to give kudos to Dr. Mukhtar, who came from the private sector and understands that healthcare is a business.
So yesterday I had the Chief Executive Officer of Fitson Healthcare PLC, and I asked him when you look at the issue of local manufacturing of pharmaceuticals, how would you rate that? He said that 50% of what we're consuming now in the country is locally produced and 50% is imported. It used to be 70-30 against local production, but from where you sit, how would you rate it? What's the percentage?
I wouldn't disagree with the gentleman, but I would want to put a caveat there. As you know, health sector is a large sector. There are different components of the health sector. In some sectors, yes, especially pharmaceuticals, I'm not surprised that it's approaching 50%. But in other subsectors, I mean, local manufacturing is quite low, and these subsectors are also very, very important. This is a transition that we started seeing, you know, just before COVID, and COVID accelerated it. We saw the vulnerabilities that can occur when there's a global shock, or when there's, actual, or whether it's deliberate or not, shortage of materials. We need to do local sourcing. So that process has started over the years. So he's right. It started off at 30%. To 70%. Definitely it has gone up. I can't be sure whether it's 50, but I won't be surprised if it's 50. My last data was it was 35, but I'm not so surprised that in terms of pharmaceuticals, 50. But if you look at other sectors like vaccinations, medical devices, which are also components, that the input from local manufacturing is actually quite low, close to 0%.
Oh, not so good. But what about medical tourism? I've heard some good news from that aspect. I don't know if it's really true.
Well, medical tourism is actually something that I'm quite familiar with. I came from the private sector, and I've been, dealing with the private sector. A lot of people don't really understand that the efforts to combat medical tourism started between 15 and 20 years ago. You have, hospitals and organizations that have been working steadily and gradually building up the facilities around it, ensuring hospital accreditation and all that stuff internally. So medical tourism is definitely improving. There was a time when the Indians were overwhelmingly taking over the medical tourism business, but you have hospitals like Evercare, Reddington Group, Lagoon and Co., who have clawed back a market share from them. And they've helped a lot of people, and a lot of people have used them as alternates to going abroad. Abroad being England, South Africa, and co. Is it perfect? Is it final? No, I wouldn't say so. But definitely, a lot of work has gone on in medical tourism over the last 15 years, 10 years, and it's a steady, gradual progression.
Is it true that the stories that we hear that some individuals who are residents abroad even come to Nigeria for medical care because of friendly costs and then head back? Are those stories true?
Very, very true. I can confirm that. Especially in certain fields that are very, very, very obvious. Like, I'll give an example of a sector of a clinical field where you see a lot of that. Dentistry. Dentistry in Nigeria is quite the skill sector. The skill set within Nigeria is top of the range. It's amongst the top in the world. And the advantage is you have a comparative in terms of cost. We have people who come into Nigeria to come and do braces, for the price of ₦1 million between ₦1 million and ₦2 million now. It used to be cheaper than that. And if you compare that to the costs that they have to pay in their own country, say, for example, in the US, something that can cost you $20,000, $30,000. The cost of a flight to Nigeria, doing your procedures and going back, it's a no-brainer. In other sectors as well, things that we do quite well. The Nigerian healthcare personnel are not given the kudos that they should be giving. Yeah, a lot of things happen. We hear stories, and nobody's denying that. But a lot of positive things are also happening within the sector, and people know that, and people come in. And like I said before, you have hospitals like Evercare, Lagoon, and Co., who service not just Nigeria, but also the West African subsector. People fly in to come and to come and avail themselves of the healthcare there and go back. It's cheaper than them flying all the way to the US, flying all the way to England, flying all the way to Saudi, flying all the way to South Africa. I mean, I am within the medical tourism business, especially in terms of organizing. One of my fields is arranging for patients to go abroad, and I find that I've seen businesses gone down because of people using Nigeria. So it's true. It could be more, but definitely positive things are going on there as well.
Maybe, doctor, you should, rejig your business structure and start arranging people coming into Nigeria for medical service.
I'm doing it. I'm already doing it. I was just giving that as an example, that just show you the transition that has occurred over the last decade, where we're doing a lot, people were going away a lot, and now you have that reduced because people are seeing alternatives. There is not just about the cost, because at the end of the day, you don't want to save money and still go and,
hurt yourself,
die, to put it in quotation here, to hurt yourself. But people can see that there are viable alternatives in Nigeria, and they're availing themselves of it. And so it's an acknowledgement of a reality that's going on. People who are in that sector can tell you that it's true. It's been a struggle. It's not easy, but you have to give kudos to those people who have built those businesses, who have built those models. They're trying their best.
So does it mean that we have overcome the personnel and skills shortage? Remember then when a lot of medical personnel were jackpying, and that was the source of worry for us in the country?
No, I wouldn't say that we have. What we're saying is that there's been an improvement, but there's still a lot of work that needs to be done. A lot of investment that needs to be done. That's why I'm happy about PVAC. It's not just about the manufacturing aspect of the healthcare sector, but it's also about the clinical aspect of the healthcare sector. We need to invest more in our hospitals. We need to invest more in our clinics. We need to invest more in the service provision. So we need to change attitudes, that kind of thing. So those things are still there. We're not over it, but it's good to see that there is intentionality from this government to give support to these sectors. As you know from doing this show every day, things are going on in the country. A lot of new projects are going on. We're still waiting to see the outcomes of it, but I'm cautiously optimistic about it. And that said a lot from me, because it's been a while since I've been cautiously optimistic about things. So I think, though at the moment it's going to take a bit of time for us to see momentum, but I feel that definitely if I compare to 10 years ago to now, even 4 years ago to now, I can tell you that a lot of things are going on, and I'm happy about it.
Would you say these things have also spread down to the primary healthcare structure?
As you know, the primary healthcare structure is mainly public sector. That is a different situation. There's some work going on. Policy changes are going on. I'm aware that the coordinating minister, has put in some new policies, new changes, some new investments in the primary healthcare sector. Just like that, these are investments that have been a long time coming. We are waiting to see how it is, but it's good that this is happening. One expects to see improvements and progress, but like you said, you have had already a lot of damage done to the sector, especially at the primary healthcare level, for years and years. A lot of investment needs to go in, but it's good to see, once again, I'm going to use that, I use that term deliberately, intentionality, progress going on. So we expect to see some improvement there, but definitely a lot of work needs to be done there if we're going to bring ourselves up to the standards which Nigerians expect, Nigerians demand, and which is appropriate for a country, a middle-income country of 230 million people.
Yeah, and one thing that you said when immediately I talked about the primary healthcare sector is, it's publicly run, and we know that for private sector driven by the drive for profitability, that's a huge incentive. So I wonder what innovations can be introduced, or perhaps we should wait and see, since you said the minister is already introducing some new things there, incentives that could drive, maybe not investment because it's more of social project, but at least can drive life to that sector, because that's closest to the people.
Yeah, you're right. Like I said, the minister has introduced some new policies there. One of the first things that need to be done, which, from what I'm told, that's happening, is increased manpower. There's a huge shortage of manpower within that subsector of the public healthcare. That's happening. Investment in the facilities. But you know that Nigeria is a very diverse area. Logistics are difficult. Able to manage it from the center is difficult. There needs to be a bit of flexibility going on there at the same time, and also the need for standards going on there. But as we know, a lot of things are being done. I also know the minister is talking about digitization. That will assist in a lot of things. It can take care of a lot of problems. But so we wait let's see what the outcomes will be in terms of what the policies are. you can already see some of the changes, there are improvements already, but we'll wait and see.
All right, we'll wait and see, but at least we do have some good news. I mean, speaking with you today and with a stakeholder from the private sector, that some positive things are being recorded in the health sector. I mean, that's good news. We hardly have such. So we thank God for it and look forward to more. Thank you so much for your time on the program, Dr. Nicholas Odifran, former Chief Physician to the Vice President of Nigeria.
Thank you for having me.